Good afternoon. My name is Leah Kaufman, and I'm the Oklahoma State Engagement Director for Shatterproof. I joined Shatterproof almost 3 years ago from the National Committee for Quality Assurance. Since then, I've worked with numerous states on implementing Atlas, an addiction treatment locator, assessment, and standards platform. We're going to start today off by providing a brief introduction to Shatterproof and to the treatmentatlas.org website. I'm going to play a short 2-minute video first, so you can hear about Shatterproof's work from our founder, from families impacted by the disease of addiction, and from legislators who have seen the impact of Atlas. After that, we'll spend a few minutes talking about some key dates and how we're implementing Atlas in Oklahoma. Finally, we'll cover how you can participate in making Atlas a success in Oklahoma, whether you're a treatment provider, an advocate, a business owner, or someone who frequently refers patients to treatment.
While we are rightly focusing much of our nation's energy on coronavirus, this is not the only health crisis we are battling. Unfortunately, across the nation, drug overdose deaths are rising among the coronavirus, negating much of the progress that we made over the last several years.
Dear Brian.
Dear Greg.
Michael Honey.
From the moment you were born, you were the sweetest kid.
You brought us such joy and happiness. Thank you for those 29 years.
We have a vision that our society will look this disease straight in the eye, prevent it and treat it with love and empathy, and with protocols based on science.
I lost 3 of my friends to overdose, all from the same sober living in the San Fernando Valley. And now I think, what if they had some access to something like Atlas in 2014?
This kind of database and transparency is the type of information that American families deserve to have, and they deserve to have it now.
Atlas is the first resource of its kind to help those seeking addiction treatments, helps them to find high-quality care and appropriate care. It was launched in 6 states. I'm happy to say West Virginia was one of them, with the hopes expanding it to many more.
That video says it better than I ever could. Finding addiction treatment is hard, especially when you're in crisis. And unfortunately, there's a lot of misinformation out there. There's often no clarity around what you should be asking or looking for in a treatment facility. And that's compounded by many other challenges. More than ever before, as we watch overdose rates rising, people need a place to go where they can find trusted information on addiction treatment in their community. Atlas aims to fill that gap. Atlas is an addiction treatment locator, assessment, and standards platform, which essentially means that the platform includes vetted information on how addiction treatment facilities are operating in alignment with the evidence-based best practices science shows works in treatment. Atlas allows families to navigate care and also helps people understand what the experience has been like for others who received care at a facility. Atlas is different than any of the other treatment locators out there. First, it's not funded by providers or pay to play. The treatment facilities in Oklahoma will be invited to participate in the Atlas survey process, which asks questions about the services offered at a facility and the population served. It will include inpatient, outpatient, residential, and intensive outpatient facilities across the state. Current treatment locators, while helpful in terms of identifying where facilities are located and occasionally what services are offered, lack any information on care quality and best practices employed at the facility. Atlas provides a starting point and identifies care that best supports long-term recovery. Based on best practices outlined in the 2016 Surgeon General's report on alcohol, drugs, and health. Atlas will show you whether facilities are delivering personalized care plans for each patient. If they provide fast access to care, you'll see whether a facility focuses on long-term management of a patient, because addiction is a chronic disease. Atlas also looks at if and how facilities connect patients to primary care and mental health resources when needed, whether staff at a facility are licensed and certified, if medication-assisted treatment is offered when clinically appropriate, and finally, how a facility is addressing social determinants of health, for example, by providing access to transportation to and from treatment, or connecting patients to social services, providing peer recovery support, and addressing housing and other social needs. So where is Atlas? Atlas is available today in 6 states. So as you can see here in orange, Delaware, Louisiana, Massachusetts, New York, North Carolina, and West Virginia. In 2022, in addition to making Atlas available in Oklahoma, we'll be expanding the platform to Pennsylvania, New Jersey, Florida, and California, which will mean Atlas will be available to 40% of the US population. Since it launched in July of 2020, over 110,000 people have already visited Atlas. With that brief overview, I'd love to show you the Atlas website. So when you type in treatmentatlas.org, you're going to reach the Atlas homepage. From here, you'll be able to search for care using your city and state or zip code. You select a search radius, and you can enter insurance information if you want. You'll also note here the ability to type in the name of a specific facility that you may have heard about. Once you click search, you'll arrive at this page. Because we created Atlas to help people navigate to care that meets individual needs, when you're ready to search, you can filter your search results by many different things you might be looking for, like location, services, and insurance and payment information. From the search results, you can select a facility and you'll arrive at their Atlas profile. There's lots of information here about who the facility serves, their hours and location, payment options, special populations they might serve, such as pregnant patients or veterans. Experts agreed that certain practices should be used when treating addiction. Atlas displays information on whether facilities offer these best practices. There's no star rating or composite score, and Atlas is not intended to be punitive for providers. Rather, Atlas identifies where facilities are operating in alignment with the evidence-based best practices that science shows works in treatment. It also aims to help facilities target where to best focus their quality improvement efforts. Atlas also makes it easy for patients to leave feedback on their experiences at the facilities and displays information to support individuals in making their care decisions. All patient reviews are subject to the Atlas Terms of Service and a rigorous review process, which includes natural language processing software and human review before being posted on the website. Providers have the ability to flag any patient reviews where there's a concern that they don't meet the Atlas Terms of Service, and Shatterproof will review and remove these reviews when appropriate. As an individual uses Atlas to explore options, they can compare up to 3 facilities side by side to help choose treatment that is best suited to their needs. One of the questions we get most frequently from providers is about the benefit of using Atlas. And we recognize that providers have a lot on their plates already. We've tried to design a process that minimizes the burden on treatment facilities. I want to reiterate that all treatment facilities in Oklahoma will be listed on Atlas, but it is ultimately up to each of you to complete the Atlas survey, which is the primary source of information that we use to populate the facility profiles that you just saw. The survey will be sent electronically to providers beginning in mid-October. We want to have rich profiles available to patients and families searching for care in different geographic areas. So we strongly encourage you to submit this. This is an example of what a treatment facility's profile looks like if a facility does not complete the Atlas survey. You can note the address, but data not available shows for the facility information portion. So you can see compared to the facility profiles we just looked at, which contain rich information for patients to use when making their care decision, this one is not as helpful. Some other questions that we get most frequently: how much will it cost? All treatment facilities are listed on Atlas at no cost, and there's no cost to those who use the website to search for treatment. Shatterproof does not accept money from treatment providers, and facilities are displayed based on geographic proximity and other factors an individual filters by. When can I do the Atlas survey? So we'll begin accepting surveys in mid-October, and we'll gather them through mid-January of 2022. What happens if we don't complete the Atlas survey? So nothing happens. Information on the services at your facility are simply not available to people looking for care, but people will be able to leave feedback on their experience of care, even if your facility does not do their survey. So as we get closer to the fall, there will be several opportunities to learn more about Atlas and provide feedback. Implementing Atlas is a collaborative effort, and we're always eager to engage with treatment providers in the community as we make ongoing enhancements to the platform. So we encourage you to take advantage of the opportunity to provide feedback by attending monthly provider roundtable meetings, where we will answer your questions and provide you with any project updates. Roundtables include treatment providers from Oklahoma, as well as other states that are newly implementing Atlas, like Florida, Pennsylvania, and New Jersey. Looking at the timeline for bringing Atlas to Oklahoma, we've been working the past few months with our partners in Oklahoma in planning this project. Providers will complete the Atlas survey this fall. Survey collection again opens in mid-October. Shatterproof will be supporting providers with guidance on how to encourage patients and families to also submit that patient feedback on the facilities as well. But first, I want to focus on the Atlas survey. In Q1 of 2022, Shatterproof will work on integrating the information that you provide to us into the website. May 2022, the site will be live for the public in Oklahoma. So how can I get involved in Atlas? Providers can begin gathering information to prepare for the Atlas survey now, which is administered online at the physical address level. If there are multiple levels of care co-located at one address, only one survey is completed for that address. But you will have the option to answer questions differently by level of care if you'd like to do so. Keep an eye out for a reference copy of the survey, along with an invitation to upcoming roundtables, where we'll answer questions and share some relevant updates. Later this month, we'll also be reaching out to verify contact information so that in October, you can make sure the appropriate person at your facility receives the electronic survey link. The most important takeaway from this webinar is that facilities will be able to complete the Atlas survey starting in October. If you're not a treatment provider, but you're interested in getting involved, we encourage you to join our mailing list and stay up to date on opportunities to provide feedback. You're also welcome to reach out to me via email if you have any questions. Thank you so much for your time today. Please feel free to reach out to me directly if you have questions, comments, or concerns. I look forward to working with you to bring Atlas to Oklahoma. Thank you.